You want to wait in a couple of more minutes? Rebecca, how we're doing number-wise here?
We have 23 participants currently. It's totally up to you if you want to wait a couple more minutes or get rolling. It's up to Dr. Rosenman if he needs the full hour.
Candy, are you going to use the whole hour?
We can wait. We're up to 25. You can give it a minute or two.
Okay.
Or you could start introducing me, George. That'll take you so long. And then so, you know, so yeah, why don't you start introducing me?
George, don't take the whole hour introducing him, okay?
Okay, all right. Hello, everybody. My name is George Abella. I'm Chief of Cardiology at Michigan State, CHM, and it's a privilege and honor for me to introduce Dr. Kenneth Rosenman today. Dr. Rosenman is a professor and a medicine in chief of the Division of Occupational and Environmental Medicine at MSU. He received multiple awards, including the Distinguished Faculty Award, Health Policy Champion Award from the department, and Distinguished Leadership Award from the Council of State and Territorial Epidemiologists. I'm not sure what that is, but you have to explain that one to me. He's board certified in internal medicine and in occupation and environmental medicine for the last 35 years under the direction of Dr. Rosenman. The Occupation and Environmental Health team at MSU has worked closely with Michigan OSHA program and the Michigan Health Department to administer Michigan's occupational injury and surveillance program. He has numerous grants and has published over 200 articles in this domain. Today, his presentation is the Flint water crisis and current updates on lead. And the objectives of his presentation are to discuss the major sources of lead exposure to adults in Michigan, discuss the symptoms of lead toxicity in adults, and to discuss the management of lead toxicity in adults. Dr. Rosenman has no relevant financial relationships to disclose or any commercial support that's provided for this CME activity. Dr. Rosenman.
Thank you, George. So here are the objectives that Dr. Abella has just been reading. And my initial slide was, remember the students who died and were shot and injured on campus. So I'm going to be talking about lead in adults, and I'm going to start. And there I am, and it's the Flint water crisis. So I'm going to start with some of the politics of this and the history of this, and what happened in Flint has led to a lot more resources being available, both for childhood lead as well as adult lead. So let's just go back for those of you who may not be familiar with what happened in Flint. In 2011, because of financial concerns, emergency managers began to be appointed by the governor. And one of the emergency managers in 2014, to save money, decided to switch the water supply, which had been coming from through the Detroit water system, to the Flint River. And this switch was done without any public hearing by the state regulatory authorities. And immediately after it began, people consuming the water in Flint began to express concerns about the taste and the smell. There were, because of microbes, bacteria in the water, there were 2 advisories to boil the water. But generally, people's concerns were not followed up on. General Motors, which has, that's the original site of General Motor facilities, stopped using the water because it was causing too much corrosion on engine parts they were manufacturing. There were a couple of outbreaks of Legionnaire's disease. And then there was an increase in trihalomethanes noted. So trihalomethanes are formed when you chlorinate water, and there's lots of organic material in the water. But still, nothing was done. The state regulatory authorities did not do anything in response to these complaints. And then sampling for lead began to be done. And it was noted at least one sample was 25 times the EPA standard. Lack of corrosion control, which should have been added when the water was switched, was identified by the EPA. But it was really people from outside the state, from Virginia Tech, who first noted multiple elevated lead levels in the water. And then the state had said, well, there's no problem with lead. And it's not so much that there was lead in the Flint River, but the corrosion of the water was causing release of lead from the lead pipes that were in the city. And then Dr. Hannah Atisha did a study related to lead levels in children. And I'll show you the key part of that result. And after she did that, prior to that, there were denials that lead levels were changing, and people's concerns were dismissed. But immediately after that, Flint switched back to the Detroit water supply. So I mean, this really was, think about environmental justice. This was really, the poor city, African-American population, and their concerns were ignored by the local government and the state government. So here's the key graph from Dr. Hannah Atisha's paper, which came out in the American Journal of Public Health in 2016. And she looked at children under the age of 6, because that's the high-risk group for children getting elevated lead, more likely to put their fingers in their mouth. And so major source for lead in children is old paint, lead-containing paint, shipping in bad condition, and the dust from that. So those are the people who, kids are generally the ones who get lead testing. And looking at blood lead level greater than 5, which was the standard at that point in terms of what was considered elevated or not elevated. And she looked at changes between pre and post the change in the switching the water pipes outside of Flint, all of Flint, and then was able to isolate those zip codes, those areas in Flint that had the higher water lead levels. And you can see it went from 4% to 10% of the kids. And this was, sort of on top of all the complaints that people had about taste. And as I said, this led to switching back to the Detroit water system. So what happened in Flint has really increased the resources available to address lead. And this highlights some of them. It doesn't deal with all of them. But CDC allocated more money. They set up a Flint lead exposure registry, multi-million dollars every year to follow the kids that were exposed. There was a Medicaid waiver to allow more resources, healthcare coverage for Flint residents, expanded lead abatement activity to eliminate water pipes with lead occurred in Flint, as well as in other cities in Michigan. The Federal Housing Urban Development year in 2017 reduced the levels at which they would provide resources. It even changed the regulations for adults. So in 2018, Michigan OSHA lowered the level that workers could be exposed to lead, and I'll come back to that since most of this talk is about adults. There was increased funds in 2021 from the federal government to remove lead water service lines. So those are the lines from the water main to people's home, typically on the person's property. Then in 2022, CDC lowered the blood lead reference range to 3.5 from 5. And again, increased funding, and even the most recent infrastructure bills have increased the money available for lead. So there've been a lot more resources that came out of the disaster that occurred in Flint. But what is so part of it was just not paying attention to people, making this change without putting the proper corrosive controls in. But why was there even lead in the pipe? So here's an advertisement from the 30s, and it said lead helps to guard your health, and talking about how important it is to have lead pipes. So Flint at one point was a very rich city. You actually could get free harp lessons in the local library, and so they had lead pipes because that was the thing that was, quote, recommended by the lead industry and was felt to be a better pipe. They would last longer. So what is it about lead that made it to be used? Acid resistance, stable in air, water, and soil, although not as stable as we found out with the corrosive water from the Flint water system. Ease of casting, ease of fabrication, relatively low expense, easier to form into shape because of its low melting point than, let's say, steel. And then the last two properties get into why lead has been used as an adulterant. So if you were going to adulterate a spice, here you have a heavy substance, high density, and sweet testing. It's sort of the ideal adulterant to add to a spice which is sold by weight, right? So it's cheaper than the spice, and it tastes good, and it weighs a lot. So we'll come back to that. So what are some of the things you need to remember about lead absorption? One, with children, and we're talking about children under the age of 6, putting their fingers, hands in their mouth, you get so much absorbed. It's higher. The rate of absorption in children is higher. Generally, there's a higher absorption if someone's been fasting. You can see 60 to 80%. And so this is true for adults, but also in children. There's an inverse relationship with dietary calcium. So if you look back in the old days of work, the workers used to get milk money. And the idea was they got extra money to buy milk to reduce lead absorption. Iron deficiency increases absorption. What we sometimes forget, or if you're just thinking about children, is that lead absorption in the respiratory tract is actually greater. So there's 100% absorption of what gets down, although depending on the particle size, only 30 to 85% will be deposited. Dermal absorption is insignificant. So you're not going to get lead absorption from bathing or washing your hands, but if you get lead on your hands and now you eat lunch, you pick up a sandwich, you smoke a cigarette, when you're eating that sandwich, the lead's going to come off your hands, get in, and you're going to get it in, you're going to ingest it. Or cigarettes, you're going to volatilize the lead on your fingers, the heat of the cigarette, and now you're going to inhale that. So it's not per se absorption, but it's contamination of the hands, which may lead to either GI or respiratory absorption. Much of the management for lead has to do with minimizing exposure, and that gets to the point of the lead distribution in the body. So lead in red cells, we're talking about the half-life's 36 days. So if at one point, if you decide, oh, I've listened to this talk and I want to do a blood lead level, what you will be measuring is what the person's exposure has been generally we talk about 5 to 6 weeks, so 2 half-lives of exposure. And it's going to be that exposure. So that's what we get when we measure a blood lead. You can see the half-life slightly longer in kidney, brain, soft tissues, and it's very long in bone. And so what happens is when you've inhaled or ingested lead, it leaves the blood and it is stored in the bone, and it's there basically, the rest of your life. And there's some equilibrium. So somebody who's been exposed to lead, a worker all their life, will some of that bone will turn over, and they might have a slightly elevated blood lead. But generally, unless they have something with some disease with a lot of bone turnover, you're not going to see that an elevated blood lead in that person. But the idea is you want to minimize exposure because most of that lead is going to stay in the bone, and we'll come back to the health effects of that. So we kind of think with our electric cars, and we hear about lithium and cobalt. Maybe they're not using as much lead, but actually global lead production is up 75%. You can see over the 2001 to 2017. And the use in the United States is up, that's worldwide, and the use in the United States is up about 26%, with the major use going into batteries. So even with electric cars, we will all still have lead batteries, and then ammunition, right? We make bullets out of lead. The lead mines in the United States are in Missouri and Alaska, with Missouri being the predominant source. So it used to be there were more primary smelters. So the ore would come out of the mine. You have a smelter, melt down the ore there, turn it into lead, or separate out the contaminants there. But now we only have secondary smelters. So like lead batteries are recycled. But there was actually just an article in one of the newspapers about much of that secondary smelters are moving to Mexico, where they have less controls. But we still have secondary smelters in the United States. You can see most of the lead use is batteries, ammunition's next. And then there's a whole bunch of, we'll come to brass and bronze, cable coverings, ceramics, print type. Some of these are historical, gasoline additives. So we think, oh, they've taken lead out of gasoline, but actually lead is still allowed. Farmers are allowed to use leaded gasoline, and jet fuel has lead. So it's not totally out of fuel yet. So here's the most recent data for lead in adults in Michigan. So this is 2022. And so the way greater than or equal to 16 is what's used to consider adults in the data. And you can see there are about 1,100 people in the state in 2022 who had a blood lead greater than 3.5. And 3.5 is used because that's the 97.5% upper limit of blood leads. It's true both for children as well as adults. And you can see that 84% of exposure in adults is from work. So unlike children, where most of it, the predominant source is decaying or lead paint in homes, the predominant source in children, in adults, is work. And you can see there are about 12,000 adults tested a year. And because adults who get tested, there's more history taken. They either get it as part of their work, or they suspect, or the doctor, the healthcare provider suspects. 9% of adults tested had this blood lead greater than 3.5. When you look at the children data, only about 2% of children have blood leads greater than 3.5, where there's more general testing and not the history in terms of what people may be doing. So what are the common work exposures. So we don't make a lot of batteries. We use a lot of batteries in the car industry, but we don't make a lot. They're actually building a new battery manufacturer in the state. So our predominant manufacturing exposure is brass and bronze foundry, and I'll show you a slide about that. Just fabricated metal that either has lead paint on it or has some lead in it. If you think about all the leaded paint out there, the guys who have to remove that paint, the recycling of batteries, and maybe what you don't think about are firing ranges, because every time you shoot a gun, there's a release of lead. So here's a pouring molten brass. So your brass or bronze fixtures in your home, you can see for brass are 2 to 8% lead, 3 to 30% lead. So, you got that hot molten metal, the fumes coming off of that are going to include lead. So there's copper zinc or copper tin, it's a predominant metal, but lead, there's enough lead in there to cause increased lead exposure to the workers there. And you can see they're standing over the fumes as they do the pouring. I mentioned, removal of lead paint. So here's an advertisement. Why is there still leaded paint in our homes? So here's an advertisement from the 1930s. High lead content paint, white lead lasts. That's why it was used. And it was not banned in the United States until 1978. So prior to that, you could paint the inside of homes with leaded paint. And so that paint lasts. And so look, we have lots of homes that were painted prior to 1978. We also, you can think about, outdoor structures. So you can see the, hopefully you can see that, you can see the paint decaying off of the overhead on an interstate, and so that they don't contaminate the surroundings. You got these tarps up in there, they sandblast that paint off. Well, that's good for not contaminating the environment, but it increases the exposure to the workers who are inside there blasting the paint off. Just another view, or here a water tower. So, and you can see homes at the foot of this tower, and you don't want them to get contaminated with lead. There's also the issue of silica if they're doing abrasive blasting, but this increases the exposure to the workers. So I wanted to share this case with you. So here's a man in his 40s. He's admitted to the hospital, loss of consciousness. His blood lead 71 micrograms per deciliter, right? So it should be less than 3.5. He's never been previously checked for lead. So even though the OSHA standard requires the employer to provide lead testing to people exposed to lead, this individual's employer never did. No hobbies that exposed them to lead. So, and that major hobby would be going to a firing range. And some of the people who go to firing range, they either will reload the bullet casings, or they'll melt down, make their own bullets, and also gunshot wounds. So if you have retained bullet shrapnel, you may have an elevated lead. So he was chelated, and we'll come back to what chelation involves for that level. He describes his workplace as a two-person shop. It was him and the owner. And what they did was refurnish and recycle car batteries. Small room, a couple of windows, an old bathroom exhaust fan. I'll show you a picture in a second. No separate place to keep his dirty work clothes. He washed them. So, you don't want to bring the lead home, contaminate your family. No shower facility, no lunchroom. No periodic blood test to see what his lead level was, no respirator, didn't wash his hands before eating lunch. He smoked cigarettes in the work area. So lots and lots of reasons why he got that 71. When Michigan OSHA went to inspect, the owner denied he had employees because he had fired the guy. So Michigan OSHA got a search warrant. When they came in with the search warrant, there were 2 new employees there. And this is what the place looked like. So, you can imagine, your garage full of batteries. There's the lunchroom surrounded by batteries. You can sort of see dust. There's the washroom, again, surrounded by batteries. This company received multiple citations for not determining what the lead levels were, allowing beverages consumed. Nobody's trained, lack of labeling, no protective equipment. So lots of citations. So I want to say something about that, so that when primary care docs note an elevated blood lead, those are the ones that really become the most interesting ones to go back and look at their workplace, because that means the company's not providing it. And you get companies like this that are doing nothing to reduce the exposure. So it's very exciting when a primary care doc identifies a lead exposure, and you can see in terms of what happens in terms of protecting the public health aspect of that. You know, I gave you the major ones. There are lots of unusual ones, and sometimes those, you know, are interesting. So who would think that in a race car, you think a race car, you want to be light, but they put lead blocks in it so that it's stabilized in a certain way. And there's a fella who goes to the racetracks and melts down lead in order to conform it to how the race car driver wants it. Print used to be lead, and so you'll have an old place that's sort of reenacting. Or think about radiation therapy. They still use lead shields, and some of these places, some hospitals will melt down and make their own lead shields. So 84% related to work. What about the non-work? So the work includes firing ranges. You know, so you think about your instructors at a firing range. We have about 100 indoor firing ranges in the state. You think about your police who have to get recertified to fire a gun, and the instructors there. But then you have the non-work. So people, you know, going to an indoor firing range is a major hobby, and it's poor ventilation in these ranges, as well as saving money to reload one's bullets or actually cast the bullets. We have people coming in from Afghanistan and other countries where, for instance, Afghanistan, the pot that they cooked with had lead, and so they were getting lead ingestion from their cooking pot. The issue of drinking water, so that clearly was highlighted in Flint. We have other places with lead lines, that service line from the water main. There may be issues of old lead solder. And so in 2022, of the 110, 15 people who had non-work exposure, we felt that about 12% were related to their drinking water. Home remodeling. So you decide, I'm going to redo my home. It was built before 78. So I just spoke to a physician the other day, and she had decided to redo our home, and she bumped up her lead level from doing that. Retained bullets, spices, ceramics. I mentioned the adulteration. So sometimes, you know, the spices, deliberately adulterating a spice, or ceramics. We don't allow lead glaze on food, but on ceramics in the United States, but you have a ceramic made overseas, and now you put lemonade in it or wine. The acidity of those liquids will cause the lead to come off. And then you have unusual sources. So just to emphasize the gun issue, this one's an animated one, but maybe I can't do it. Oh, there it goes. So you get lead coming off from the hammer in the back. So that's going to get on your hands or your clothes. It's coming off out of the barrel. And so that's just going to get in the general air and settle out. And then you have the casing from the bullet, and now maybe you collect the casing and tumble them, and now that's contaminated with lead. So, this is the major source of exposure, of non-work exposure. Retained bullets, not a major source, but I just saw this fellow in clinic a month or so ago, so I thought it was interesting to show him. So he's a 49-year-old. He was shot in 2007 with birdshot, and you can see all those metallic birdshot, and he put his right hand across his chest to protect himself, and much of the birdshot stayed in his right hand. He did have a history of elevated lead as a child. He didn't know what it was. He had seen his primary care doc, had a blood lead of almost 13 in July, and had some vague symptoms, and I'll get to that in a second, and came to, well, I guess I saw him in November of 2022, and his repeat blood lead was 20. Generally, that's slightly higher than I'm used to seeing with shrapnel or retained bullets, but he had a lot of them, right? He's got 76 pellets in his right hand, 37 in his chest and abdomen. I'm not showing you his left arm. Generally, you see blood leads from shrapnel, retained bullets, if they're in pleural spaces and joint spaces. So presumably, they're in joint spaces in his hand. I guess I'll just say something about his treatment. His symptoms, his blood lead's not high enough to cause symptoms. And so you would follow this periodically, and you would only remove these bullets if he was having sort of pain from the bullets, and it's possible he had some limitation of his right hand, but you wouldn't remove these bullets to try and reduce the blood lead. Contaminated herbal and supplements. So lots of instances in the medical literature of lead either deliberately or inadvertently getting in to various substances. Moonshine whiskey in the United States, using old radiators which have lead solder, and that lead leaching off into the alcohol. So let's talk about symptoms now. So this is an below 5, and we're talking about adults now. You're not going to see any. So I divided this column here in short-term risks and long-term risks. So you'll notice. Let's just look at the short-term risks. There are no symptoms. So there's concern about effects on pregnant women, or maybe a woman who wants to become pregnant, is planning, and so this retained lead. But you're not going to see symptoms at these levels, and we're up to 29 there. Long-term risks, however, you can see issues in terms of hypertension, chronic renal dysfunction, cognitive dysfunction. So I have it as definite at 10, but you can see it says possible at lower levels. And it gets back to, when we get to management here in a second, you're not going to see acute, you're not going to treat for potential increased cardiovascular mortality, but you want to reduce the exposure to reduce that possibility. And then, so someone who already has hypertension, somebody who already has renal dysfunction, or any of those others, the lead can compound that or make that worse. So this is a slide from a book just illustrating, effects of lead on adults, on cognitive function. And, here are the symptoms. And these symptoms are very subjective. And we can all think of lots of conditions, where people have myalgias, paresthesias, mild fatigue, irritability, lethargy, occasional abdominal discomfort, even as you get at moderate toxicity, joint pain, fatigue, difficult concentrating. These are all mild, moderate. You're gonna have blood leads greater than 30, and you're not going to see these at lower levels. And in adults, you're not going to see, psoriasis, encephalopathy, colic until you get up into the 60s and 70s. And I've actually seen people, somebody who had a blood lead of 100 and they're walking around saying, "Doc, I feel great. I don't know why you care about my blood lead." So, but you can at these higher levels. So the case, that fellow clearly had abdominal issues, and as you get up higher. But these mild, moderate toxicity, not uncommon, more common than the severe toxicity in adults, but are going to occur when you get to blood leads greater than 30. Gout, related to ingestion of alcohol with lead in it, right? Good adulterate, it sweetens the alcohol. Abdominal colic, I just thought that was a nice picture of intense pain there. This is, at one point, women were using a white lead-containing powder for powdering their cheeks, and they used enough of it, right? So with higher lead levels, you get wrist drop, and you get weakness of the muscles of the extensor muscles of the hand. And so there was a particular company selling wrist braces for these women who were getting wrist drop from lead exposure. Very unusual. I guess it's good for an exam. This issue of this bluish line along the gums, which is called Burton's line, and but you have to have teeth in bad condition. So with periodontitis, and so there's the blue line. It's not something you're going to see. Now we get into the higher exposures. So some of the literature would say you don't even see those non-specific, those mild, moderate symptoms till you get to 40. Although there's some data that says at 30, as I've been saying. But now as you get into levels at 40 and greater, you see these additional, you get the non-specific symptoms for sure. You get neurocognitive deficits, certainly on neurobehavioral testing. It may not be clinically obvious. You'll have sperm abnormalities, and long-term, if somebody runs a blood lead for elevated blood lead for a long time, increased risk of hypertension, kidney dysfunction, and you can get anemia, the abdominal colic, and even higher levels, peripheral neuropathy with wrist drop and gout. So we generally are saying, hey, what we hand out to patients, we're saying 40 or greater danger, 25 to 39 caution, and 3.5 to 24 alert, less than 3.5 normal. So here's your management. So somebody comes in, you've thought about lead, they gave you a work exposure, they tell you they go to a firing range regularly, and you decide, okay, I'm going to do a blood lead, and you do a blood lead, and you get a result. So less than 3.5. Well, I shoot 3 times a week, doc. My number's 3.5. Well, maybe we'll check you again next year for your regular physical. You just want to make sure you're checking them with that they shot their guns within 5 weeks of when you did the blood lead. 3.5 to 9, discussing health risks, minimizing exposure. You don't want to continue to accumulate lead in their bone, so you can follow that up. 10 to 19, so 3.5, consider removal for pregnancy. 10 to 19, remove. 20 to 29, you start talking about remove from exposure. So that actually now is Michigan standard. So in the country, you're allowed, OSHA allows you to have either your blood lead can be 60 or below. 60 micrograms per deciliter or two values greater than 50. So you could say 50 if you have two of those, but if you only have a 55 and then your next value is 40, OSHA would say that's okay. In Michigan, you can't have a blood lead at work greater than 30 or two values greater than 20. And so now we start talking about remove from exposure. If it remains up, as it goes up, we remove from exposure, medical evaluation. I'll talk about that in a second. Higher levels, remove from exposure, because really reducing the exposure is the most important thing one can do for an individual. And they will urinate out, but move most of that lead into their bone. So we can chelate somebody, but somebody may be walking around who's asymptomatic at 60. There's no particular reason to chelate them because, quote, you're not going to remove enough lead from their body. It's going to go into their bone. Unlike children who get chelated at 40 or 45, the CDC recommendation is 45, where you're trying to protect against encephalopathy. The likelihood, you're not going to see that in an adult. So here's what I was talking about in Michigan. The OSHA standard was changed in response as part of one of the changes in response to the Flint contamination. Previously, it was 60 or two values or above 50. Now it's two values, 20 to 29. Previously, somebody could go back to work when their blood lead dropped to 40. Now it has to drop down below 15. I'll say something about zinc protoporphyrin. The Michigan standard did not make any changes in any error levels, action levels, or who needed to have medical screening as part of the OSHA standard, but it did lower the level at which people had to be removed, and so is more protective than the rest of the country. So no other state, every other state in the country is at 60 or two values above 50. So what tests might you do? So when I talked about medical evaluation, so lead can cause anemia. Generally, we're talking about above 50. And so CBC, lead can affect kidney function, creatinine BUN. So zinc protoporphyrin, I think it's my next slide. Lead inhibits certain enzymes in the production of hemoglobin. And at one point, or still, the protoporphyrin that's measured in the lab is actually zinc protoporphyrin. And so there's a machine where you can get an instantaneous reading, zinc PPP. We've now eliminated that as a requirement in Michigan because it really doesn't add much, but you might want to consider it in somebody who had an elevated one. And I remember seeing somebody, this is the highest I've ever seen, somebody with a blood lead of 400. And the issue was it was a battery manufacturer, but it was felt, nobody else had a value anywhere close to that. And it was felt that he either was contaminating himself or the fellow workers felt he was working too hard and people were putting lead in his thermos. And so he had a normal zinc protoporphyrin, which was really strange given how high his blood lead. So that was an example where, that might be useful, but generally it's not very useful. Nerve conduction, so we're talking about either sensory. So the risk drop is the traditional or the classic toxicity from lead, but you'll also get sensory changes and reduced semen counts, sperm counts, and or changes in motility. Right, so I was mentioning lead effect on enzymes, so it affects aminolevulinic acid dehydrase, so ALA goes up, but it also is involved here and affect hemoglobin or further along in protoporphyrins. And so people can become anemic, but generally we're not going to see that until they're 50. But that's where that zinc protoporphyrin test comes in. So what's the treatment? And I have in larger print removal from exposure, and because that really is the treatment. I'd say it's been at least 5 years since I've chelated anybody. In adults now we're using oral chelation. They are doing that in some places for kids. The issue with oral chelation is you got to make sure the person is still not exposed to lead, because you could say, oh, well, let's get these workers who are exposed to lead, let them take oral chelation, it'll reduce. But actually what it'll do is it'll increase their absorption in their gut. So you don't want somebody still exposed to lead when you're orally chelating them, or there's intravenous chelation. But obviously oral, you don't have to hospitalize the person, low toxicity. I mentioned the chronic effects of lead, and there have been a number of studies with this X-ray fluorescence, because lead's going to the bone, where have looked at these adverse health effects in relationship to body burden or X-ray or body burden of lead in their bone. You could also do a chelation challenge, an EDTA challenge, and most of us will have elevated urinary levels, and they're not, in terms of acute symptoms, it's not going to get you anywhere. Although that you have certain docs who want to sell herbal supplements or chelation products, they will do an EDTA challenge. They will find elevated lead in the urine. They'll find lots of other metals, and then sell their patients various herbal supplements. This one example of increased cancer or increased mortality based on lead levels. And as people have elevated levels, some of these are not statistically. So the 10 to 19 group in this study, includes 1, even though the odds ratios or the SMRs are elevated, it includes 1, so they're not statistically significant, but they were with people with blood leads 20 to 29. And just another example of peripheral blood disease, peripheral arterial disease. So there's a trend that's statistically significant, but and at much lower levels, but the risk is not elevated at any particular quartile. There's one study, and it's interesting. It was repeated twice by the same authors from Taiwan, where it was double-blind study looking at people with elevated serum creatinine who had no history of lead exposure, but had increased urinary lead on EDTA mobilization, and they chelated them, and they found that the chelated group had slightly better GFR. The first time they did it, it was 27 months, so 2 years. The second time was 4 years. I've never seen any other author. So, this is a suggestion. Well, if somebody's had chronic lead toxicity, is there any evidence that we can reduce their chance of having a chronic condition like chronic kidney dysfunction? So there was some, slight improvement or less decrease in their GFR. But this certainly is not recommended, and I have never seen any authors try and repeat this in any other situation. I just want to mention children. I mentioned before that generally we see about 2% of children have elevated blood leads, and so the recommendation is that, and Medicaid requires it, that at the age of 1 and 2, children be tested for lead. And refugees, the state is now considering a policy to require testing of all children age 1 to 2. Here are the results for children, just to put it in perspective with adults. So we have about 2,000, this is 2021, about 2,000 children with blood leads greater than 3.5 compared to approximately 1,000 adults. So a much larger number of children. It was even larger pre-COVID, about 150,000 a year. With COVID, that testing's gone down. So we're talking about maybe 23% of kids were being tested. Now it's down to about 14%, about 100,000 a year. The testing will vary by location. So like Detroit, more kids are tested. Partially, it's related to Medicaid and a Medicaid requirement. But just to give you an idea of, what the blood lead distribution in children is compared to adults, CDC recommends chelation at 45. In Detroit, they chelate kids at 40. I'm winding down here. So we banned residential lead in 78, and you can look at the mean blood leads prior to that. So prior around 76 to 1980, 90% of children 1 to 5 had blood leads greater than 10. So I see I have the mean here on this side, but let's just look at 10. So now we're talking about 3.5. So as various things, as lead was taken out of lead paint, out of gasoline, out of the lead solder in our can of peas, you can see that the percentage of children with blood leads greater than 10 has markedly decreased. The geometric mean has markedly decreased. But we still have an issue with lead paint. So another advertisement from, how about 2014? Will your house still be there? And Dutch Boy white lead will still be there. So just to give an example and why workers will continue to be exposed, as well as the major source to kids, we have about 1 million residents built in Michigan before 1950, and another 2, so they're going to have higher lead levels, and another 2 million built between 1950 and 1980. In 2022, governmental funds abated 284 residents in Michigan. So you can divide 3 million by 284. Now, it's true if you abated your own home, that's not going to be included in that 284. But the government spends about $20,000 per resident, or about $6 million a year. It's going to be many, many years before all that lead paint is abated in the housing just in Michigan. I want to briefly mention take-home lead. So I've seen adults get blood lead done by their primary care doc, and the level's 7, and the doc, so it's not particularly high, and the doc will talk about minimizing exposure. But what doesn't get spoken about is, are you bringing that lead home on your clothes, on your shoes? So there's a rich literature of take-home lead, and that's why the workplace standards says people have to be provided showers, clothing shouldn't be brought home. And so this issue of take-home lead. So Michigan State University did some guidance for local health departments targeting intervention to prevent take-home leads in Genesee and Ingham County, and found lead in the cars. The lead levels were not done in people's homes, but in people's cars, or even in the infant seat in the back seat, elevated lead levels in workers' cars. And so there's a literature of something to be handed out. So I guess my point was, you have an adult, maybe their lead levels are not particularly high. You're going to talk about minimizing exposure, but you want to think about, do they have children under the age of 6, or they're older? Do they have grandkids who regularly come to their house? So summarizing, acute lead toxicity or nonspecific, mimic many other conditions. Very easy to do a blood lead test. All the commercial, you just order blood lead. It's not useful to do a urinary lead, because all our data on health effects, either acute or chronic, are based, other than if you're going to do X-ray fluorescence, which is not clinically available, is based on blood. So you want to do a blood lead test. Unlike other heavy metals, where like arsenic or mercury, you want to do a 24-hour urine. Chronic effects, blood pressure, kidney, The primary treatment and prevention is to stop reduced lead exposure. Very occasionally, maybe you're going to chelate. Likelihood of that is very low, and not doing it a lot, you may just refer them to somebody else. And the fact is that lead is still widely used, and then I already said readily available blood tests for diagnosis. So non-specific symptoms, you got a lot of fatigue, and you get some history. Oh, I'm remodeling my home. I've knocked down a couple of walls. When was your house built? It was built before 78. Easy thing to do a blood lead test, because they're exposed, maybe they're exposing their family. If there was lead paint, you need some special cleanup procedures. Okay, I left 6 minutes for questions.
Thank you, Dr. Rosenman. That was a great review on lead toxicity, and it brings back a lot of memories, actually.
Well, that's good. You don't have the neurocognitive deficits, George. That's good.
Well, I played with lead when I was a kid. I used to melt it and make figures by casting.
Yeah,
So
lead soldiers. Yeah.
I survived, I guess. There is a question here from a participant. I can't see the name.
I can see the name, Jake Rowan.
Yeah, hey, how you doing? Thank you so much for that talk. What other heavy metals do you recommend we look for in patients who may have also had lead exposure? Is there other things that kind of go together that we should be paying attention for?
The simple answer is no. The neurologist, maybe I don't know your specialty, but neurologists somewhere in some of their training say, oh, I got somebody with a peripheral neuropathy or paresthesias, and maybe I should do a heavy metal screen. Really what you want to do is get an exposure history and target. So where do we see arsenic, for instance? And I'll show you how it's different. I mean, arsenic can be a natural contaminant in water. So you're not going to see it in somebody on municipal water, but they have their own well water, and there's certain areas of the state, like the thumb. So that might be an example. There's certain metal processing in the steel industry, annealing, where you might have it. But most of the elevated arsenic levels we see are people ingesting fish. And the form of arsenic in fish is a non-toxic variety. And the doc doesn't tell the person to avoid fish for 48 hours. They do a urinary test, or they do a blood test for the arsenic, and they should be doing urinary, and they haven't avoided fish. And so you get the organic arsenic, which is not harmful. And if you forget, or the patient eats fish, you want to immediately speciate the arsenic to see if it's non-organic, which is harmful. And then mercury, we see that again with fish. Now, the mercury in fish is harmful, but again, that's a very different exposure from lead. Mercury arsenic generally is not work-related. Lead is work-related. Guns, as the major non-work-related source, is not an issue with arsenic and mercury. So there's really not, I'm sure I could come up with some overlap, but generally there's no overlap between the various metals.
Thank you.
Other questions for Dr. Rosenman? While we're waiting, I can mention that, there is a theory that the Roman Empire declined because they added lead to the wine to sweeten it, and that kind of reduced the fertility of the population. Any thoughts on that?
Well, I've read the same thing. I can't say I've ever, I can't say, so how would you try and prove that? You would look at bones.
Yes, skeletons.
From the Romans and see if there was elevated lead there.
Right.
And that certainly could be done. And was there enough lead to reduce fertility? I guess I don't know, but yes, I've read that, and yes, that's, but they definitely did sweeten their wine, because lead is sweet. And
Right.
so, you didn't have a good grape crop and you want to get some sweeter wine, let's add some lead.
There is one question from a little earlier in the chat from
Okay.
Dr. Hossain. He asked, how did Virginia Tech get involved in the Flint water crisis?
So the state was really non-responsive. I mean, the state, the environmental protection was saying it's not an issue. And Virginia Tech had a history. So there had been a problem with contamination in Washington, D.C. with lead pipes. And the same person at Virginia Tech got involved with that. And he was contacted by one of the residents up in Flint and came up and brought his graduate students. And it was really that outside involvement that, got the state to change its tune. But he was invited in by a resident. The other thing that happened in Flint just was this whole issue of legionnaires. And so the corrosive water was thought to have also freed up Legionella from the pipe. And there were it's never been published, but there were about 45 individuals who developed Legionella. Some of them were outbreaks in one of the hospitals there. When you look at a number of people, although the cases have dragged on for years, were indicted for manslaughter. It wasn't related to the lead. So we're talking about the health commissioner, the chief medical officer for the health department. It was related to deaths from Legionella, which also is thought to have been related to the increased corrosiveness of the Flint River on the pipes. So, when you got a film, and so this film on the inside of the pipes, the Flint water, the increased corrosiveness, remove that film, release lead, release the microbial organisms that were living in that film.
Ken, I think we're running out of time. Thank you again for this inspiring review on lead poisoning. Thank
Okay.
you all.
See you, George. Bye. Bye, everyone.
Bye-bye.